I'm going to be discussing some environmental and cultural factors that are related to elderly living alone. So here's an outline. We're going to be talking about these topics. And let's jump right into it. So first off, the media's portrayal of elderly is that they are frail, weak, fall a lot, they're helpless, and this can be a huge downfall for this population. They are not these frail little things that only fall. They are independent people, and we need to help them stay independent for as long as possible. Some issues with support is family support. Do they have children and do they live close by? And are these children able to help them? If they're part of the sandwich generation, which is where they are taking care of children of their own as well as their parents, this can be very difficult. A study done in 2019 by Parker and Penn stated that with an aging population and a generation of young adults struggling to achieve financial independence, the burdens and responsibilities of middle-aged Americans are increasing. Nearly half of adults in their 40s and 50s have a parent aged 65 or older and are either raising a young child or financially supporting a grown child age 18 or older. And about 1 in 7 middle aged adults is providing financial support to both an aging parent and a child. This can be a huge burden on these people, and so they might tend to slip on helping out their parents. Another factor is if the elderly in the family live in a city or rural area, do they have the access to more resources or not in rural areas? They might not be able to get outside help. Some aspects for roles of peers. Results by a study done in 2019 looking at effective peer group education on quality of life of elderly individuals with diabetes showed that results of peer education increased the quality of life of patients with diabetes with significantly better results than the researchers' training group immediately after the training. Thus, this method can be improved quality of life of aged populations. So, overall, peer support can be a huge benefit to individuals who live with medical chronic conditions. Having that support and someone to talk to and help influence to living a healthy lifestyle can be very beneficial. It also helps to have social interaction that makes you happier, want to do more. It's just a great source for elderly living alone. So, elderly living alone, just elderly in general, they have a cyclic nature. The World Health Organization defines ageism as stereotyping. It's a prejudice and discrimination towards people aged based on age. And prejudice and discrimination are an unconscious level, but are never challenged, thus making it an implicit and non changing through time. Ageism cuts across the life course and stems from the perception that a person might be too old or too young to be or do something. This can be critical in elderly life because of these views that they're too old or too frail, they're too weak to do stuff. They get left out, which increases their social and self isolation. Um, yes, we were talking about elderly living alone, but it's important to look at the Ombudsman, which is an advocate group for elderly living in facilities. You can report any abuse, they can get legal help, and the Ombudsman in, is a resident advocate for elderly living in long term care facilities, and they help to improve quality of life. Nationally, in 2018, the Ombudsman Program investigated over 194,000 complaints and provided information on long term care to another 409,000. We need to get Ombudsman out. Let every elderly know about this so that they can get help and increase their quality of life. Some potential barriers for elderly is the isolation. They live alone. They don't interact with people. They might not have the peer support if their peers are dying, depending on their age group. And do they have transportation? Do they still have a driver's license or not? Can they get to where they need to be? Also, with this ageism, the stereotyping, they're not included because they're viewed as being too old or too frail, too weak to do some things. And their socioeconomic status, are they receiving Social Security? Can they afford to live alone? Or can they afford to get outside help? Can they afford their medications and medical bills? Also, how well do they use technology? They might not understand the internet or their phones, and so they can't connect through that. But they're also very vulnerable to scams because of these stereotyping as these weak, old, frail people. They are an easy target. Also, do they have like home health care or volunteers coming in and out of their house helping them out? This opens them up to a lot of fraud and having their belongings stolen. So there's an international scope. This is not just in America, but Turkey has this great program where they are fundraising to create an elder city so that these individuals can continue to live at home but still have many resources. They also have created the largest Alzheimer's village. So instead of locking these individuals up in a lockdown unit, having a fenced in, very small yard, they have a community. They still have the social interaction. And the World Health Organization did an analysis in 23 low and middle income countries and estimated the economic losses from three non communicable diseases, including heart disease, stroke, and diabetes, in these countries would total 83 billion between 2006 and 2015. The health and economic burden of disability also can be reinforced or alleviated by environmental characteristics that can determine whether an older person can remain independent despite physical limitations. The longer people can remain mobile and care for themselves, the lower the cost for long-term care to families and society. So with these elder cities, they can remain in a home, be independent, continue to be mobile, which increases their lifespan, helps them have a healthier, happier life, increases their quality of life, and they have help managing their chronic conditions, which can decrease the cost of our health care. With the increased life expectancy, this study showed that by the middle of the century, there could be 100 million Chinese over the age of 80. This is an amazing achievement considering that there were fewer than 14 million people this age on the entire planet just a century ago. By 2030, non-communicable diseases are projected to account for more than one half of the disease burden in low-income countries and more than three-fourths in middle-income countries. Infectious and parasitic diseases will account for 30% and 10% respectively in low and middle income countries. Among the 60 and over population, non-communicable diseases already account for more than 87% of the burden in low, middle, and high income countries. So we need to also, when we're looking at the elderly population, we need to make sure it's a healthy environment and decrease these communicable diseases so that they aren't overriding the costs of the medical system. Some health disparities looking at the socioeconomic status of this population. Do they have enough retirement and savings? Are they receiving disability and Social Security? Is this enough to cover their living? Also, with polypharmacy, they're getting prescriptions from numerous doctors, and prescriptions are very expensive. Does their insurance cover these medications? Do they have transportation to their doctors to help manage their conditions and continue with their medications? Also, chronic conditions and managing them are very expensive. Is there affordable alternatives? Do they have any help with that? Looking at the race, religion, and gender, there are some differences. With gender, in 2010, 70% of older men lived with a spouse. Only 42% of older women did. Also, looking at race, there's a variability in race and whether they live alone or not. So, older non-Hispanic white women and black women are more likely than women of other races to live alone, 39% each, compared with about 21% of older Asian women and 23% of older Hispanic women. Also, again, ageism. This really has a huge impact on aspects of life, with isolation, decreased health outcomes, and less solutions for social problems. With perceived discrimination, whether based on race, gender, or age, has a negative health outcome. Ageism has been shown to have significant impact on our participation in society, health, and longevity. For example, evidence shows that those who hold negative attitudes on aging have slower recovery from disability, live an average of 7.5 years less than those who hold positive attitudes, are less likely to be socially integrated. Ageism also imposes barriers to the development of good policies on aging and health, as it influences the way problems are framed, the questions that are asked, and the solutions that are offered. In this context, age is often understood as sufficient justification for treating people unequally and limiting their opportunities for meaningful contribution. And then geographical location, where these individuals live, affects their health outcome. If they're in a rural area, they don't have as many health resources, but they can use telehealth, either in a clinic where the doctors can consult with other specialists, or they have the virtual MDs where they can call a doctor to see if they really need to go into a clinic or if they can get help through the phone. Some biases on an unconscious and unconscious level, again with the ageism, they have poor health outcomes if they are biased against, they aren't getting the support, they're not getting the opportunities, and it increases isolation and loneliness, which increases depression, and it just has poor health outcomes. On an international scope, in Northern America and Europe, elderly are more likely to live alone compared to Latin Americans, Asians, Africans, and Caribbean, where more than half the population of individuals over the age of 60 live with their children. For most of the world, caring for the elderly is a family affair. Family care for the elderly, however, is substantially challenged, especially in societies where traditional family structure and relationships have changed due to the influences of the demography, urbanization, political economy, and cultural shifts. While awareness of population aging and its associated elder care demands has gained global attention in recent years, the gaps in knowledge, services, and policy in supporting families to provide and sustain adequate care for elderly people are persistently large. Professionals who are concerned about elder care problems worldwide need to understand that the complex situation of family care and also information on best practices of care. They need to understand support within the family, for the family, and between the family and health and social services institution. This was said by the Harvard Medical School, the family care for the elderly. You need to involve the family depending on their views. And that is it. Here are my resources. Thank you.